Hi, this is Lee, licensed acupuncturist and herbalist. Today I'd like to talk about bronchiectasis. This is a condition that your chronic coughing and inflammation in your airway damage the walls of the bronchus. So you have chronic coughing and a lot of phlegm, and eventually you breathing is influenced, so it can cause congestive heart failure or respiratory failure, and your lips look purple, and your legs swelling. And the reason I talk about this condition is my patient, one of the patient and also friend, survived colon cancer for 8 years. And because the colon cancer metastasis to his lung, so part of the lung was cut, and also he got radiation therapies, and he survived everything. He exercised, he eat right, but he has this chronic coughing and phlegm accumulating his bronchus, and that damaged the airways, the small bronchus. So one time, I think it's last Thanksgiving, he coughing up the blood, a large amount of blood, and was sent to Boston Medical Center and artificially induced a coma. He was in coma for a week, but then he came out and he survived. But he didn't know that the phlegm, you have to resolve the phlegm and a chronic coughing. So he still loves ice cream and eat dark chocolate, even it's good, but it all aggravates his inflammation in the bronchus. So his lung function continued to be damaged. And past week, he had another surgery to cut part of the lung, and the surgery is successful. But after a few days, he passes away at age of 46. I was shocked, but then also I was very, very sad that I didn't insist in his taking herbs, because when he came to me, has chronic inflammation in his airway, and I said, why don't you take some herbs? He took some herbs to clear up the phlegm, and the symptoms get better. But in Boston area, physicians don't like herbs, so he stopped. He only used inhaler, which just temporarily dilate the bronchus and let him breathe a little bit smoother when he exercised. But chronic inflammation is still in the airways and eventually damage majority of his lung. So that's why his lips are always purple, and he was short of breath when he was exercising. And the last time he coughing blood, and he didn't survive the surgery. And it's such a sad story. And I was looking back how he worked hard to help cancer patients, how he survived the metastasis of the cancer. But bronchiectasis killed him. And I didn't insist in him taking herbs. So next episode, I'm going to talk about when you started coughing for more than 2 weeks after antibiotics. If you would like to take some herbs, you can avoid chronic inflammation in your airways and maintain your lung function. For more information, you can go to bostonchineseacupuncture.org and search herbs and acupuncture for chronic inflammation in the airways.